My name is Gwendolyn Howard. Students call me Mrs. Howard, and I am the school social worker and an instructor at St. Martin de Porres High School. When I was a child, I always wanted to be a teacher, and so when I went to college, I majored in education. However, while I was in school, I realized that education would limit me, and I decided that I wanted a broader career. So I majored in social work, which also allows me to teach as well as work with people individually and in groups.
I'm Reginald Blue. I'm a psychologist and an educator. When I grew up, I really hadn't thought anything about what I was going to do for a living. Work was in my future, I knew that, but what I wanted to do, I had no idea. I see myself as a helper. Seemingly growing up, I typically talk with a lot of my friends about things that were going on in their lives, and I came to realize slowly but surely that people like to talk, and everybody talks to someone, and I just slowly went into it. I started teaching, and I realized that I was doing more than just teaching students. I was also discussing with them some of the problems that they had growing up or in the home or whatever. And I just transitioned from that into teaching at the college level and then ultimately being a psychologist.
My name is Jason Joyce. I'm the Executive Director at Hitchcock Center for Women. Well, in high school, I started thinking about what I wanted to do in college, and I knew I wanted to help people. And I was looking at psychology, and with psychology you have to learn a lot about yourself. So with that, I was very interested in that, and I thought combining those two of being able to help people with an interest in psychology and kind of how people work would be a good fit for me.
My name is Sharday Hollins, and I am the Behavioral Health Prevention Specialist at the Adams Ward in Cuyahoga County. When I was younger, I wanted to be a lawyer, a teacher, and then a lawyer again. I really didn't know what social work does, where they can work, other than that they worked with children. And even though I like kids, I must tell you, that's not really what I wanted to do. But as I dived into the reason why I wanted to be a teacher and a lawyer, it was because I wanted to help people. I wanted to touch people's lives. And the more that I thought about it, I wanted to do that outside of a classroom. I wanted to do that outside of a courtroom. And I learned that social work is actually a great field to go in, that I can work in hospitals, I can work in a courtroom, in a law firm, I can work policies, I can work anywhere. So not only am I a teacher or work with law, I'm a social worker. I'm literally everywhere. And I've had that experience in the years that I've had my master's degree.
As an educator, I help young students and sometimes older students by imparting information and helping them to understand information a little bit better. And as a psychologist, I do the same thing. People have problems. People typically would like to talk to someone about the problems, and I help people work through the problems they have and hopefully make things better for them. It's rewarding for me because I'm able to help people improve their lives. That's one of my primary goals.
What I do depends on what's going on in the lives of my students. If a student is having a difficult day, I'm here to make that path a little clearer. So what a difficult day looks like for a student could be that that student didn't have any food last night, mom or dad may have lost their job, someone may have been rushed to the hospital through the night, and so I'm here to help those students navigate and have a good experience while they're at St. Martin de Porres in the classroom academically and socially as well. My day-to-day work is a challenge and it is rewarding. I love it.
My job really entails overseeing an entire agency that helps people. And what that agency does is it helps people who've had some trouble with taking drugs. And when they take those drugs, they get into trouble themselves. So we're there to help them get out of that trouble and move on with their lives so that they can feel and live better. My day-to-day work is mostly administration at this point. So I do emails and meet with people and have meetings. I'd say the part that I love the most is the actual supervision. So that's going in and talking to other therapists about what they're working on and helping them out on difficult situations or questions that they might have. The line of work that I chose is rewarding because seeing people change is an extremely rewarding process, right? So in being able to be a part of helping someone change, whether that's in the field that I work in, helping people get off drugs, is something that is lifelong and something that will carry with them forever. And knowing that you had a little piece of help in helping people get off drugs is extremely helpful and something that I take a lot of pride in.
Every day, I have the privilege of working with community behavioral health agencies. Now, it may sound like a big word and phrase, but they're really people that you see every day wanting to make an impact in your life. So, you may not see me in your school buildings, but who you do see are social workers, counselors, people who have gone through life and are a part of recovery, knowing that there were ways that they were coping with life that were not the best, and they want to make sure that you don't make the same mistakes. Those are the types of people I work with. I work with them to figure out what are some really cool and creative ways to make sure that while you're sitting in your classroom, while you're at your rec center, that you can engage with positive adults, that you can engage in a support group with other peers, and that you can learn more about coping. How is it that I can get through the stress about school? That I can get through the stress about what I'm going to wear to prom? That I can get through the stress about the fact that I'm in school and it's COVID? Or that I'm not able to be in school because it's COVID? Those are the types of people that I work with every day. So I may not see you, but I work very closely with the people who do. And that is what I do every day as a social worker.
I would recommend social work as a career choice because it sits under a wide umbrella of opportunities. As a social worker, I already mentioned that I teach, but also I have an opportunity to work with people from all age levels. I can work with preschoolers, with senior citizens in different areas. I can work in prisons, in the court system, in hospitals, medical centers, addiction treatment centers. The list goes on and on about the opportunities, and it's all investing in people and in our communities. So it's a wonderful career path.
So the favorite part of my job is helping others. So getting to know and have a relationship with a client and then being able to support them through difficult times so that at the end they're feeling significantly better and they're able to go back to their friends and their family and where they work. So that's really why I love what I do.
Everything that I wanted to be when I was little, I became as a social worker. And you can too. You're still young, but you're old enough to know what it means to be in behavioral health. You're old enough to know that you can make a difference. Yes, lawyers, teachers, doctors, all of those things are great. But when you go into the behavioral health field, you literally can touch people in all of those areas. Anytime, any way, any day. So just think about it and find somebody in your life who works in the field and feel free to ask us some questions. I look forward to hearing from you.